Hello, beautiful people. You're welcome to my YouTube channel, Nursing with Abby. Another wonderful episode from the series Antenatal and Motherhood Series. So, today we are going to have a concluding session of antenatal care. Why I need to go for antenatal care. So, please sit back and relax and enjoy the ride with me. But before I go ahead, I'd like to thank all of my subscribers for always supporting this channel. Thank you so much. I do not take your support for granted. Thank you so very much. And if this is the first time of watching me, my name is Nurse Abiodun, Nurse Abi for short. I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. On this channel, Nursing with Abby, we talk about nursing, lifestyle, and everything in between. And our goal is mother alive, baby and babies, or babies alive. So today, I said we'll be having a continuation part of the antenatal series that I asked the question, why do I need to go for antenatal? Now, we gave a brief description as to antenatal, what are the things I need to, the questions I'll be asked and all that in the first episode of this particular series. Now we're going to continue with the routine tests that needs to be done for a pregnant woman. I'll be concluding the antenatal care today. So make sure you still have your pens and papers because you need to write some things down. So on your first antenatal visit, they're going to be asking you a lot of questions. We talked about that in the previous video. But they're going to ask you to go for a test. That it could be a blood test, it could be a urine test. So make sure that you're prepared for that. They're going to have to check you, you're going to have to get a needle prick. But all is for the goal of mother and baby or babies alive. So don't fret, it's important, it's necessary. So the first test, they might ask you to, they can give you a container to put your urine into it. And the urine could be midstream. That means that you'd urinate a little out, and then in the middle you hold on, take a little of the urine into the container, and then urinate the remaining out into the toilet. So that is midstream urine testing, and you give the urine to maybe the lab personnel, and it's going to test for presence of infection, urinary tract infection. It could test for presence of glucose or sugar in your urine, or they could test for presence of protein in your urine. Those are markers to show that probably there could be a problem, or there could be an impending illness that needs to be addressed or treated. Now, they could also ask for a blood test where they will draw up blood from either your forearm, and they'll put them inside bottles. Now, those blood tests are to check for, number one, HCG, that's human chorionic gonadotrophin. That's to confirm that you're pregnant, especially if it's at the first trimester. You're going to check your blood group. If you're blood group O, if you're blood group A, blood group AB, blood group B. We need to know the kind of blood group that you have. In case you need to be transfused, we need to be certain of the kind of blood group you have. Either you're rhesus negative or rhesus positive. That's also very important. One for blood transfusion, and one to be sure you don't have a risk of rhesus incompatibility. That means that if you are rhesus negative and your husband is rhesus positive, it's like two poles that are opposing. So there could be issues with the pregnancy or the delivery. So if such a woman is rhesus negative and she's had the first pregnancy and delivery, no problem, there could be a sensitization of that rhesus incompatibility or sensitivity at the second pregnancy. So it is important that such a woman knows early and is treated. She's going to be given what we call ROGAM injection, which is given at 28 weeks and within 72 hours after birth. That is to help or prevent the next pregnancy from having issues and this pregnancy to be safe. So it is important that such test is done early, and then the woman is prepared psychologically and financially for you taking this particular injection, because it's quite expensive. Then we also check for complete blood count if we want to know if there's any intending infection, if there's any hiding infection, any latent infection, and treat before it affects the baby. We also want to check the level of blood in your system. That's if you want to check if the person has anemia. Now, anemia is due a PCV, that's packed cell volume. We want to check if the woman has enough blood in her system. Now, I tell my antenatal mothers, I say there is no time during pregnancy or delivery rather that you do not shed blood. How much blood you're going to shed, we don't know. So it is important that the mother has enough blood stores in her system. So even when she sheds blood during delivery process. She still has enough to take her through and to take care of her baby after delivery. So we advise and we encourage our mothers to have at least PCV or packed cell volume of 35 above. In my clinic, it's 35 above. So we advise such mothers to increase their nutrition on blood-forming foods like spinach, use of blood tonics, and some people, even in severe cases, they might have to give them iron dextran. So we also check for hepatitis B. Hepatitis B is very important because it is transmitted through sexual intercourse, and it could affect the baby. So we need to check if the woman has hepatitis, and because it could increase the risk of liver failure in such pregnant women. So we need to care for them especially. Then we also need to check if there's presence of human immunodeficiency virus in the woman's bloodstream, because this can be passed from mother to child if adequate care is not given. But we've had a lot of cases of HIV positive mothers who use their drug and adherent to their drugs well, and they did not transmit it to the baby. But it's important that it is early detected, and then the mother starts on antiretrovirals as soon as possible. And your healthcare provider will do all the care for you to ensure that your baby is HIV negative if you are positive. So there is no problem about that. I've had so many pregnant women who are positive and they delivered negative babies, even from HIV negative partners. So it is possible and doable, but you need to listen to instructions. Then we also check for syphilis, yes, and gonorrhea, because those sexually transmitted infections also have negative effects on the baby if not treated and treated well. We also check for German measles, which is rubella immunity, though that is not very common in the developing countries like Africa, because we are immunized right from birth. But for other countries, you might check for German measles immunity in the mother. If she doesn't have it, then it's important for her to take it immediately after delivery, and she must not be pregnant 3 months after the intake of the vaccine. Then we also check for sickle cell traits or sickle cell or thalassemia. Those two are also genetically inclined, and they could be transmitted to the baby. We could also check for the presentation position, the liquor of the baby. We can also check the placenta location from ultrasonography. That's what we call ultrasound scan, or scan for short. So the woman goes to the lab for the ultrasound scan, the radiology department, and she lies down on her back, and she a gel is placed on her abdomen, and there is a particular probe that is being placed around her abdomen with a screen. So you can check how the baby is, the lie of the baby, the presentation, the position. You want to check the amount of water or liquor the baby has. You want to check if there is no congenital abnormalities. Some can be detected with ultrasound scan. You want to check the placental location. You want to check if there is no pooling of blood anywhere. You want to check if there are no fibroids or cysts. We want to check the other surrounding areas of the reproductive system if they are all fine. Then we can also require some vaccinations, which is whooping cough and flu vaccine, which is given at 16 to 32 weeks. Now, this is not very common again in Africa, but in the UK, it is advocated that a pregnant woman from 16 to 32 weeks is given whooping cough and flu vaccine. For quite a number of people in Africa, it's been given for all babies right from the time they are young. So it might not really be institutionalized like that in other countries, but in UK it's a big deal. Now, there are also some other tests that could predispose maybe a woman with high risk pregnancy, a woman who's had a baby with congenital abnormality. They might require such a woman to do some specific tests, which are a bit different from the regular routine tests that I slated down now. Some of those are amniocentesis, where they try to take a little of the liquor of the baby to check if there is no congenital abnormality like Down syndrome, like Patau syndrome. They could also do chorionic villus sampling. So those are tests that they are special tests, and it's being given for women probably who are well advanced in age before their first baby, for women who've had babies with congenital abnormalities, or for women with high risk pregnancies. But your physician will communicate such to you as needed. So these are the tests. Then there's also abdominal palpation. That's when the midwife or the practitioner lies you down on the bed and checks the baby. Yes, especially when the baby is about 7 months, 6 months, 7 months upwards. Now we want to check the presentation, we want to check the breathing of the baby. We could even use the Doppler ultrasound to check the fetal heart rate, that the breathing of the baby. We're going to count it if it's within the normal limit. We could even do what we call a fetal cardiotopography. That's a bit advanced, but it's very important for us to know the baby's the baby's states at that moment, especially when the baby is moving. When the baby is normally moving, that's non-stress test, or we might even go advanced to contraction stress test. So those are the tests that are done in obstetric and gynecology unit, but those are also very important for good outcome of both the mother and the baby. So I hope I've been able to give you a brief history, a brief introduction into the blood test and the various investigations that you're going to be doing on antenatal. So we are going to see in the next class, and we're going to be talking about some other very, very important things. So please ensure that you stay tuned. So thank you so much for subscribing. Thank you so much for your support, and thank you for noting down all these points. And our goal again is a healthy mother, a healthy baby. So till I see you in my next episode, it's bye for now. Have a beautiful day.